Welcome. I'm Rogers Anderson, Williamson County's mayor, and as we travel around the community here in Williamson County, we're always trying to find shows that people will enjoy. Maybe they're a little different or you didn't know anything about it. And today we have the opportunity to talk to a Vanderbilt physician, and we're going to spend some time on allergies and diseases, and his name is Dr. Andrew Nichols. Thanks for being with us.
Thank you for having me.
So tell me a little bit, I mean, you're not that old to begin with, so tell me a little bit about yourself. Where'd you go to school? How'd you get interested in being a physician?
Well, thank you. Yeah, so my family moved to Knoxville, Tennessee about 15, 16 years ago, and I ended up deciding to be a doctor because my father is a physician, and so I grew up around healthcare providers and found that calling that way. And I ended up at University of Tennessee for medical school and enjoyed it. And in my family, I have a brother who suffers from really severe allergies and nasal polyps, and I saw how much good his allergist did for him. And I decided to go into allergy. And so I trained in internal medicine and pediatrics at the University of Chicago, and then went to Mayo Clinic for my allergy training. And then am happy to be back in Tennessee and enjoying the practice and the warmer weather here.
Well, you certainly don't look that old. Congratulations for holding your youth.
Thank you.
And so I also want to let the folks know that are watching this. Recently we had another show where we had the public health department. Well, we've had several shows where we've had different people come on and talk about public health and issues that relate to public health in our community or outside of our community. And part of the conversation today over at the public health department were some concerns and discussions about not just in the area of sinuses and allergies, but allergy diseases. And one of those that came up, and you'll have to excuse me, I've got to read this one, is called alpha-gal, G-A-L. What in the world is that?
Yeah. Well, it's a very interesting type of food allergy. And alpha-gal stands for galactose 1,3-alpha-galactose, which is the carbohydrate that people who have alpha-gal are allergic to. And the alpha-gal, so we could start by talking about what an allergic reaction looks like.
Please.
So when we think about allergies globally, many people think about an allergy as something that if it gets in us or on us, we have symptoms that we don't like. And that would be a broad definition of allergy. But when allergists and physicians think about allergic reactions, we think about something called anaphylaxis. So a whole body allergic reaction that looks very similar no matter what the allergen is. And those symptoms, 80 or 90% of people will have hives, so raised red whelps that are very itchy, that can happen anywhere on the body. The next is swelling, so swelling of the lips, the eyes, the tongue, the throat. That can cause blockage of the airway. You can have respiratory symptoms, coughing, wheeze, shortness of breath. Some people have GI symptoms, nausea, vomiting, and then people can have cardiovascular symptoms, meaning lower blood pressure, higher heart rate. And if you have one or more of those things going on after the exposure to an allergen, we call that anaphylaxis. And that would hold true for a typical food allergy such as peanut or milk, which most people are familiar with. Alpha-gal has a couple of very unique features to it. So the first feature is alpha-gal is an allergy that you can pick up after you're bit by a tick, which is very, very unique. It was first described in 2008 by Dr. Platts Mills at the University of Virginia, and it was the first time that was ever described. And what happens is the tick will, it's the Lone Star tick, which is really regional to the southeast region, will feed on a deer, and then that deer will bite a human being, and the blood meal then will be exposed to the human, and they will develop an allergy to beef, pork, and lamb.
Beef, pork, and lamb. All
So
right.
mammalian meats. There are some reports of venison also causing allergic reactions in people who have alpha-gal, and very rarely gelatin, which is derived from a mammal source, as well as cow's milk. But the main allergens are beef, pork, and lamb. So the first unique part of alpha-gal is that it's caught and developed after exposure to a tick. The second unique part of it, as I mentioned, is alpha-gal is a carbohydrate. And most food allergies come from protein exposure. So the protein in the peanut, the protein in the milk. So that makes it somewhat unique. The last piece of alpha-gal that makes it very unique is that most allergies, whether it's medication allergies or food allergies, they'll happen within about 2 to 5 minutes to up to 2 hours after exposure to that protein. So if you're allergic to a peanut and you eat it, you'll have an allergic symptom about 90% of the time within those first 2 hours. Alpha-gal is classically a delayed allergy. So you'll eat the meal of beef, pork, or lamb, and 3 to 6 hours later develop the symptoms, which makes it very confusing. I meet many patients who will come to me and say, "Doc, I ate my normal dinner. I was feeling just fine when I went to bed 3 hours after my meal or 2 hours after my meal," and they'll wake up at midnight with hives and swelling of the lips and difficulty breathing, and it's a very confusing situation. But then they come to us and we sort it out.
So you've kind of described some of the symptoms, and when this particular time of the year, when in our county and many other people, they're out deer hunting.
Mm-hmm. Mm-hmm.
They're around cedar thickets, groves of pines. As a country boy myself, it was very, very unusual not to have a tick. The mom had to work on you when you got home, and she was checking all parts of your body to make sure that she removed all the ticks. But not every tick on every deer would have alpha-gal, would it?
You're absolutely right. And scientists and physicians don't know why.
That was where I was going with it.
Certain people can get bit by a tick and not develop this, and others can. And it likely is a combination of the perfect timing when that tick has fed and then gets on the human being, but also probably a combination of their genetic makeup and predisposition to developing this allergy. And unfortunately, just as with regular food allergies, scientists haven't yet discovered the exact causative link to these situations.
So if you happen to have any of those symptoms that you were talking about, the rash and the swelling and the increased, decreased heart rate, sometime after eating one of those meals of beef or pork or lamb, why not chicken?
So it's not a mammalian meat, and so that carbohydrate is found on the muscle of the beef, the pork, the lamb, so that, because they're related in an evolutionary standpoint. But poultry and fish do not carry that carbohydrate, so it's safe for people to eat that.
Since we didn't rehearse this show, I know there must be more than one tick other than the Lone Star tick. Mm-hmm. But it's just that tick that's unique, or that's the one you've identified at this point? Yeah,
in America, the Lone Star tick seems to be the major driver of this disease. There are some other variations of ticks that are present in Europe. I don't know them as well, but there are other ticks that can carry this. But the Lone Star tick seems to be the most prominent.
Well, before we get into some insect allergies, you make an excellent case to at least spray your body with some repellent if you're out into the woods, or particularly if you're a hunter.
Mm-hmm. Yes, so avoidance, to definitely not get this, we'd want people not to be exposed to ticks. And so we do recommend using DEET, repellent that has a high level of DEET, D-E-E-T. That really is very helpful in keeping all insects off, but particularly ticks. If you're out hiking and you're doing not deep woods hunting, we do recommend people stay on the inside of trails and not get too much into the bushes. And then also making sure we cover ourselves completely and don't have exposed skin when we're walking through forested lands.
And is there any way, I know this may be a little gross, is there any way to remove the tick once it's attached onto your skin? Is there one way to remove that tick opposed to some of the others? I've heard the old wives' tale, as I'm letting you think about how to answer that. you take a hot match, touch it to the backside of the tick, it'll back it set out. I can tell you, all you wind up doing is burning yourself.
Yeah, so I agree with that. I think the best thing to do is to really just have alcohol present to clean the area, and then just try to gently remove it. And if it doesn't come out gently or it hurts too much, of course, I would see your physician about that.
So let's say you've been to the doctor has, I've gone to you, you've identified me as alpha gal, what now?
Yeah, so it's a great question. I think there are two parts to that. The first part would be is the most important part of my job when I see a patient is the history. So talking to the patient about what happened, what were the exposures that surrounded it. And so if someone comes to me and they've had a convincing history of an anaphylactic reaction, and there was that exposure to the beef, pork, or lamb, the next step is we usually draw blood to look at this molecule called IgE that's specific to this carbohydrate, the alpha-gal carbohydrate. And when that's elevated, that will confirm the diagnosis for us. Then once we confirm the diagnosis, the unfortunate thing is there's no cure for alpha-gal. We recommend strict avoidance of beef, pork, or lamb. And then we also recommend that patients carry an epinephrine auto-injector, so that if these symptoms were to happen from an accidental or intentional exposure to the beef, pork, or lamb, and they developed symptoms of an anaphylactic reaction, they would use the epinephrine, and that's injected into the front of the thigh. And that, what happens in an allergic reaction is a histamine is released throughout the body, and that causes blood vessels to dilate. And that's why we swell on our lips, that's why we get the rash on our skin, that's why we have difficulty breathing, and our blood pressure will go down. The epinephrine causes a very quick reversal of that dilation and causes the blood vessels to clamp down, and that gives us time to get to the emergency room. So avoidance of the beef, pork, and lamb, and anything else you're allergic to, as well as the availability of epinephrine, is how allergists help people from being in trouble.
So before we move on to some of the insect stinging allergies that may occur, let's highlight, we don't want to scare everyone that's watching this show, that it's rare, very rare, small incident, or we're just now learning more about this?
The true answer is we don't know for sure. I would say rare. But whenever anybody has symptoms of anaphylaxis, which is actually not rare, we love to see them in clinic to help sort all this out. So alpha-gal in itself is a rare disease, but we see it frequently. I probably see a patient, myself and my partners will probably see 2 to 3 patients a week who either have alpha-gal or are worried about having alpha-gal. And based on previous work at Vanderbilt, we think there are about 150, 160 patients that we have in our clinic that have alpha-gal.
Amazing.
Yeah.
Let's talk about stinging insect allergies. So tell me about stinging insect allergies.
Well, thank you. I think this is a fun transition. When we think about the alpha-gal, it's an allergy you can catch by being outdoors. And with stinging insects, it's the same situation, but this time it's the actual stinging insect that you're allergic to. So there are 5 species that we worry the most about. So bees and honeybees, and many people in this region as well as many parts of the country are beginning to either hobby or commercially harvest and grow bees. Then there are wasps, paper wasps, yellow jackets, white-faced hornet, and yellow-faced hornets, as well as we are just on the cusp of the upper edge of fire ants. And fire ants can also cause allergic reactions. When we think about what we're worried about, anaphylaxis, as we've just talked about in the setting of alpha-gal and food allergies, can also occur if you're stung by these insects.
Not all wasps sting?
That is true.
And I know this is silly, but I'm not going to wait around to find out which one stings and doesn't. I'm going to try to get rid of them.
Yes.
So what do we do? And the precautionary would be to watch out if you're running barefoot. I mean, we tell our children or grandchildren they're going to get stung if they're going barefoot in the yard where there's clover. It's just natural. Many of us that still do our own mowing, you're going to mow over a hole in the ground, and all of a sudden the yellow jackets are just going to emerge on you and wear you out.
Yes.
What do we do then?
Yes. So I think the major thing, one is to remain calm. And the second thing I think is to know where these things congregate so we can anticipate them swarming. The big things with yellow jackets, the classic story that I'll often hear is I was at a picnic and I drank my Coke and I got a sting on the lip. And that's classic for yellow jackets. Yellow jackets are scavengers, and so whenever you walk through a park and you see a flying insect around a trash can, or you're at a church picnic and there are insects, flying insects, or what looks like a wasp or a bee of some sort around the picnic, those are classically yellow jackets. And we know yellow jackets are the most common type of stinging insect that will sting somebody because they're very aggressive. As opposed to honeybees, they're typically not as aggressive, as well as paper wasps and then the yellow-faced and white-faced hornet. Those are particular when you're around the nests. And so also being aware of where these insects will nest. The paper wasps are often in the eaves of the home. And then, as you said, there are others that will burrow in the ground, and being aware of the locations can keep us very safe.
So you're stung. What do we do then?
So it's a great question, and I think we should, as you say, not to scare people. Only about 3% of the population will have a severe anaphylactic reaction when they get stung. So most people will not. The normal sting symptom is a very quick, painful lesion that will often be red and slightly raised, but within hours will go away and you'll be okay. And that's the large majority of what people have. There's a next type of allergic reaction that allergists will call a large local reaction. So some folks will get stung, and over the next day or two, they'll get progressive swelling at that site. So it'll go from just a little bit to 12, 18, 24 hours later, becoming much larger, warm, sometimes itchy, sometimes painful. Those are worrisome and bothersome from a symptom standpoint, but they're not life-threatening. Those folks, we usually recommend antihistamines, sometimes things like ibuprofen, and if they're very bad, we'll often give a day or two of steroids, prednisone. And that happens in about 10% of people. The last category is the systemic reaction. So if you get stung and you have any of those symptoms, so hives, swelling of the lips, swelling of the eyes, tongue, throat, difficulty breathing. You see the theme here with anaphylaxis. No matter what the allergen, the symptoms are all very similar. Low blood pressure, high heart rate, nausea, vomiting, abdominal cramping, the like. For those folks, if it's the first time, they probably don't have epinephrine with them to use. If they have epinephrine or epinephrine is around, you want to use that right away and get to the emergency room. Without epinephrine being available, you want to get to the emergency room right away so folks can get you epinephrine as well as antihistamines and steroids. And most people do well. There's probably about 40 deaths in the United States every year because of stinging insect allergies. So it's not a high cause of mortality across the United States, but it's a preventable cause. That's why allergists like to help people with it.
So I have heard that bees that sting in the joint seem to hurt worse than they do it, say, on the forearm. There seems to be a tendency of swelling, the elbow, under the elbow, some of the more fleshy parts of our body, and then swelling occurs the whole arm. True or not true?
I probably would say partially true. I think when you think about if I were to swell in the middle part of my arm here, it would be swollen and warm, but I wouldn't really be moving it as much as if it was over my joint. So it's probably a selective realization that when your joint has overlying swelling, warmth, and pain, you're going to notice that every time you move, and you'll probably be paying attention to it more. So it probably does hurt more. I think from an allergic standpoint and a safety standpoint, it's probably no more dangerous around the joints.
We're not touching at all, but care to mention, since we got a little extra time, about spider bites and other creatures that can sting or bite.
Well, I'll admit that that's not my specialty because those insects do not cause allergic reactions of the type we're talking about.
Really?
So you think about mosquitoes. Mosquitoes can cause large local reactions, but there are probably only 3 or 4 case reports in the whole world of a mosquito causing anaphylaxis. Same thing with spider bites as well. They can be toxic at the site, and we all know the brown recluse spider
Sure.
that will cause necrosis at the site of the bite, and that can be quite painful and sometimes cosmetically unfortunate, but it won't cause an anaphylactic reaction. So in my day-to-day practice, I usually don't come across those commonly, or I have people who come in and ask me, could the mosquitoes be causing allergic reactions? And oftentimes it'll be large local reactions, but not the anaphylaxis or systemic reactions that we see with the Hymenoptera is what we call the stinging insects that can cause anaphylaxis.
So I went into an area that you're not specialized in, and I apologize for that.
No.
But let me go back to the bees then. How about these men and women, and there's a huge need. I'm a ag boy. I love messing around with my garden.
Yeah.
I will plant all kinds of zinnias, flowers to attract the bees so they'll do their work on my garden products.
Yeah.
And I have been stung many times in my life and really don't think a lot about it when I'm sticking my hand down to pick some nice yellowneck squash or zucchini squash, and there's plenty of bees around there. But these men and women that work in harvesting the honey, surely, do they get immune to these stings to a certain degree, or is there a possibility at some point later in their life then they'll have to quit that hobby or occupation?
So that's a great question. I think we anecdotally, working with folks in the clinic who are beekeepers, as well as having colleagues who take care of them, and also we try to reach out to the beekeeping community to let them know we are a resource for them. Most of the folks, it seems, who keep bees don't have a lot of problems with the allergies because they are continuously exposed, and that probably helps protect them a little bit. The one thing that when we meet people in the clinic and talk about bee sting allergy is we actually have a really good treatment for venom anaphylaxis. So someone will come in and see me, and we'll talk about their symptoms, and it's very clear they have allergic reactions, anaphylaxis to flying insects. And then what we can do is we can do skin prick testing as well as blood testing to look to see if they have sensitivity, documentable sensitivity to any of those five we talked about. And if they do, we have immunotherapy. So venom immunotherapy that is in the form of shots that we can start on someone for either bees or yellow jackets or the mixed vespids that we identify. And so if you're stung by a bee, let's say a honeybee, which is not the most likely to sting you, but is the most likely to cause a severe reaction if you get stung. We can do venom immunotherapy, and that will, if we don't do venom immunotherapy, you have between a 30 and 70% chance the next time you get stung by a honeybee, that you would have anaphylaxis. So a history of anaphylaxis makes you more likely in the future. It's not certain, but it makes you more likely in the future that you'll have anaphylaxis. By doing a 3 to 5 year course of venom immunotherapy, which starts out multiple times a week, and by about 3 months into it, you're doing it every other week, and then it turns into a monthly injection. After 3 to 5 years of that, you decrease your risk of anaphylaxis down to about 10%, and the chance of severe anaphylaxis down to about 3%. So not only are allergists good at identifying what you're allergic to, particularly from a stinging insect standpoint, we are also very proud that venom immunotherapy can really move the needle on people's future risks. So one of the best part of my job is to meet someone who's been stung, who's had anaphylaxis, help them, one, understand what anaphylaxis looks like, how epinephrine can keep them safe if it happens again, and three, offer them venom immunotherapy that will allow them to get back on the saddle and not have future anaphylactic events. And we find people's lives are changed. They feel empowered to get back out in nature, to garden again, to beekeep again, whatever it might be. And that's the most meaningful part of a physician's job, is when people can get back to doing the things that they love.
So it leads me to ask the question, just one more. I'm sitting here just amazed at some of the things I've learned today, but when you have you have a reaction to an insect for allergies, and the areas you're talking about, or if you go back to this alpha-gal reaction, is that hereditary? Can it be passed down from one generation to the next?
Yeah, that's a great question. Certainly when it comes to traditional food allergies,
Like
eczema,
peanuts.
peanuts, milk, soy, wheat, shrimp, fish, those are the most common allergens we see. People who have eczema, people who have allergic rhinitis, so nasal congestion, hay fever, and asthma, all those diseases we know have a genetic predisposition. So if your parents or grandparents have them or your siblings have them, you're much more likely to have them. We term that as atopy. Atopy is a broad term for being more allergic than other folks. Bee stings and alpha-gal certainly have a genetic component. It's not as strong as the other atopic diseases. And if someone, I often will get the question, someone will come in, they'll never have been stung, but they'll say, oh, my mother is definitely allergic to honeybees and I wanted to come and be tested. And we recommend against that because a family history of an allergy doesn't mean that a person themselves will be allergic. They might be a little bit more likely. When you think about venom hymenopter sensitivity, it's about 3% of the population. So maybe those people are instead of a 3% chance, maybe they're a 5 or 6% chance. But we don't recommend prophylactic testing in the setting of a family history. But the interaction between our genes and our environment are very complex, and we haven't found a simple answer to that question just yet.
Amazing. Well, we've got 2 minutes left on our show, and I am sure that I have overlooked something that you would like to discuss or get out, maybe something that I've not been able to concentrate. It's been fascinating to hear this study of alpha-gal and the stinging. I just figured that was just part of growing up as a kid, but fortunately I've not had those things. Have I overlooked something that you'd like to talk about?
No, I don't think so. I really appreciate the opportunity to come and talk about this, and I think we've gotten a flavor today, and I've been able to share enough to let you know and your viewers know that allergies is not as straightforward as one would think. And there are a lot of nuances that allergists will think about when it comes to being allergic. So starting with the history and the exposures, and from there picking the appropriate tests that can be helpful. And then if anybody has anaphylactic type reactions, so the hives, the difficulty breathing, the cough, wheeze, shortness of breath, swollen lips, abdominal pain after any exposure, that's what we want to help people with. And alpha-gal is a very unique and special food allergy, but there are many other things we can be allergic to. And I also would like to thank the Williamson County Public Health Department for allowing us to connect and share this information, because I know we have patients who really are interested in getting the word out on these diseases.
Thank you, Dr. Andrew Nichols.
Thank you so much.
For kind of going into a great deal of depth about alpha-gal and stinging insect and allergies in general. If you want to know more, talk to him. Go through our public health department. He works at Vanderbilt. Let them give you his name and number. And thank you for being with us today. I'm Roger Sanderson. As we sign off, we'll see you around the county at the next appropriate time. Have a good day.